Hey guys, this is Dr. Yusuf Mathai with Oregon Health DPC, and um, I've been thinking recently. Uh, I'm always thinking. If it's a day that I'm not thinking, it's a problem. But I've been wanting to share a couple of thoughts in some sort of format, and so I'm probably going to end up calling this video series the Rambling Corner because I am want to go out and ramble, as my patients tend to tell me. But I actually wanted to talk a little bit about our patients and some of the interesting stories that we tend to be part of within our system of our direct pay practice or direct primary care, concierge type medical practice, which we've had for the last 6 years, give or take. And again, it's been an amazing privilege to be able to work within that system. Our physicians will usually echo the same thing, having come from other systems where it's insurance-based. And so a lot of our physicians definitely tell us that it's been a privilege to be able to work in these spaces within this system. And one of the things that as I was reflecting and contemplating the last 6 years, especially thinking about the impact that we've had with our clients, is, well, I actually started to ask myself, why do we have the impact that we do with our clients? As physicians within this system, are we that much smarter than the physicians that are in, the insurance-based systems like Kaiser, Legacy, or Providence? And I would say it would be very arrogant for us to say that we are. I most certainly don't see myself being any smarter than any of the other physicians that work in the other systems. The one thing that we do have, undoubtedly, is access to the one resource that is limited and everyone is limited by on every single day. And that's times. I always look at why we are able to get to the root cause of a lot of our clients' issues. And really, when I think about it, again, like I said, I am no smarter than the average doc. I think most of the providers that work for us are a lot smarter than I am. But again, the one thing that I do have access to is patients' time. What I mean by that? Well, most of our patient interactions tend to occur on average over a 45-minute to an hour and a half period of time. What that allows us as physicians to do is, one, ask the right questions, because if you don't ask the right questions, you will never get to the bottom of what's going on. So we have time to really listen to the story of what brought you in. When I was in training, it was always drilled in us that, your diagnosis or what ails the patient is truly in the history. And one of the first skills that medical students learn is history taking, and we often forget how important that is. But, in history taking, you actually get the full story, and really your labs end up just being the thing that confirms what it is that you're thinking. And so it becomes very hard to get the story in a 10-minute interaction, in a 15-minute interaction. And so, honestly, I think even sometimes in an hour and a half interaction, which we are able to do, it's extremely hard to do that. And so again, we have been able to spend time with patients, which is one of the most it really is the only resource that is not renewable, right? Like, once the time is gone, it's gone. And so again, for us, it's an honor and a privilege to be able to spend that time with our clients. But it really does afford us the ability to listen to their story, right? Listen to really try and drill down to what's going on. Often, honestly, it makes us look most of it makes me look a lot smarter than I really am. But again, it really truly is time that we're able to spend with our clients. Again, I am always eternally grateful to our clients for being able to to give us that time. And again, it's a privilege and an honor to be able to do that. I did want to highlight, so one of the things that I'd absolutely love to be able to highlight during these short videos is really talking about what I call, and I really don't have a name for this yet, but it's to highlight some of the things that our patients have taught us, and how working within the system that we're in has really allowed our patients to thrive, and to thrive, so to speak. So I recall an interaction one of our physicians had with one of our clients, and this is going back a couple of years, but it really does highlight the availability and time that we're able to spend with patients. So this patient had talked to one of our providers and one of the physicians in our practice, and had been having some issues with some indigestion, acid reflux. And from what I can remember, it was this interaction maybe happened on a Monday. So our physician got on a call with the patient, and we're trying to troubleshoot what was going on. The physician at the time thought your symptoms are very similar to acid reflux, maybe gastritis, which is inflammation of the stomach lining. And the physician came up with a treatment plan, which the patient agreed to, and said, hey, listen, if these symptoms are not better by Thursday, let's go ahead, schedule you for a phone call. And if symptoms are not better, let's figure out what's next. So Thursday rolls around, and the provider physician gets on call with a patient. The patient's like, you know what, about 70% of my symptoms are better. I think you hit this right on the nail on the head. Pregnant pause. But I wonder if there's something else going on, which is what the patient had said at the time. And so the physician said, well, you know what? You could be right. Even though you are getting better, maybe it makes sense for us to see you in the office. And so in talking to the physician, her recollection was that the patient was, well, do I really need to come in? And the physician basically said, hey, listen, you said there could be something else going on. Really, the only way we can do that is, let's lay some hands on you. Let's see you in person. So the patient was scheduled for an appointment with the physician the next day. So Thursday, they had a conversation. So timeline, Monday, they talked initially. Thursday, they had a follow-up conversation. Friday, the patient is seen in the office. And to the physician at the time, based on the history, based on the physical examination, it sounded like this was cut and dry, gallstones, maybe inflammation of the gallbladder. So next step is to order some imaging. The physician ordered an ultrasound for the patient. We were able to call a couple of local imaging places, got in the patient Saturday morning for that imaging. Get the results on Monday morning. Physician is reading the report. Nothing in the gallbladder. Gallbladder looks pretty good. Something funky, looking on the liver. But there was something else in the colon that made the physician pause, be like, that's weird. That's an unusual finding. So called up the patient. And again, one of the advantages is we're able to call up patients. Our lines of communications tend to be pretty open. So the physician called up the patient and said, hey, listen, this ultrasound doesn't show any gallstones, but there's something else weird happening here in the liver, which I'm not too worried about. There's something else here going on in the colon that definitely warrants further testing. Interestingly enough, we were able to get the patient a CAT scan scheduled that very day. I believe it was at about 5 o'clock. Physician walks into the office on Tuesday morning, and it looks like it's cancer, on the CAT scan, which was quite an unexpected discovery. So the physician was able to hop on a call with the patient same day, and go over the findings and pretty much come up with a plan of action, which from my recollection and from the physician's recollection, because we helped coordinate some of these things, by the end of the second day, Tuesday, when we actually got the diagnosis, the physician, the patient, and a specialist were able to actually hop on a phone call, chat about the diagnosis, potential diagnosis. That patient ended up having a tissue diagnosis on Friday. So, from initial onset of contact with our practice to tissue diagnosis of a cancer diagnosis was less than 2 weeks. And again, I always look at this case as being one where we were extremely lucky in terms of catching something, but we really would not have been able to do this if we didn't have time. This is a patient who could have probably come in for 15 minutes interactions, mentioning in passing that there's something going on with, their stomach stuff. By the time they get any sort of imaging, you're looking at, a couple months down the line, which would have definitely delayed diagnosis. So again, this is one of those cases where I don't think we're any more brilliant in terms of our diagnostic skills and capabilities than any other physician elsewhere. Really, what we had was the advantage of time and just really being able to think through, okay, what else is going on, but the time to also help the patient coordinate their care and navigate a very complex system. So yeah, that is my short rambling spiel for today. If you find this to be valuable to you, we would love you to subscribe to our young and fledgling channel. Alrighty, guys. Again, this is Dr. Mathai with Oregon Health DPC. Hope you guys have a fantastic rest of your week. All right, bye.